This is Mariah and Maria, and we are going to be explaining about how action potentials work and about how nerve cells transmit those messages to help us function. And so this is our model of a nerve cell that we created in class. And these are the dendrites and the axon, and then the terminal axon and that are dendrites. And then, so first, what happens is another nerve cell will release action potentials, which are represented by these little fuzzy balls, and the action potentials are taken in by the dendrites of a nerve cell, and once that meets like an action potential threshold, that means that it's reached the amount that it needs to work to like fire its message. So we have the threshold for this one is 3. The dendrites will then release these 4 sodium ions that have just kind of been chilling into its axon. And so the 4 sodium ions move into the first section of the axon, which changes the charge on the inside to a +3 charge, and then the charge on the outside is a +2, which causes these the sodium and the potassium channels to open, which means that the potassium is going to start flowing out of the cell and sodium is going to start flowing into the cell. And so you're going to have 4 sodiums flowing into the cell and 4 potassiums flowing out of the cell. So what happens then is those 4 sodiums that flowed into the cell are going to move into the second channel, which is going to cause the +3 charge on the inside and the +2 charge on the outside, which again will cause the sodium and potassium channels to open. The sodium and potassium are going to flow, and the +4 sodium that flow in are going to move on to the third section of the axon, which again causes the +3 on the outside and +2 on the +3 on the inside and +2 on the outside, and the channels again are going to open. The potassium and the sodium are going to flow, and the +4 sodium is going to move into the 4th channel, where the same reaction will happen again, as you can see. And then finally, the +4 sodium is going to move to the last section of the axon, and what that is going to do is it's going to trigger the the action potential is flowing down with the sodium, and so what happens is these action potentials will be released, and when the action potentials are released, they're released as a chemical, which are then picked up by nerve cells. There they are being released. They're picked up by nerve cells in the area to continue their path up to the brain. And so this is our final picture of the nerve cell. All of the channels have closed, and as you can see, all of the potassium is on the outside of the cell, and there is a lot more sodium on the inside of the cell. And so there's just one more final picture. Thanks. Have a great day.